Webster was dropped off for a dentistry today. What exactly is a dentistry? What actually goes on behind closed doors? Let's find out. There's Webster, waiting anxiously to have his teeth scaled and polished. So the first thing that's done with Webster is we just want to do a physical exam and make sure that he's healthy prior to putting him under anesthesia. A lot of cases will often pull blood too as well, just to make sure that there's no underlying liver or kidney problems. So prior to going under anesthesia, animals require an injection. We call it a pre-medication, and it's just going to help keep the heart rate up. Thank you. That's the dental machine, much the same as what you would experience if you went to your dentist. You can see over to the left is the high-speed drill, in the middle is the polisher, and the hand scaler is on the right-hand side, the blue handle. It's been 5 minutes since we gave the injection, the pre-medication. There's 3 things in the medication. One is ace-promazine, which is a tranquilizer, so that's why he's looking sleepy. Torbagesic, which is a pain medication, which will help during the procedure, and glycopyrrolate, which is a medication that helps keep the heart rate up. So as you can see, Webster's getting sleepy, so it's time to start. So Webster is now on the treatment table, and we're going to be putting the IV in to his arm first. The technician will be doing that. So Webster now has got an IV in place, and his IV fluids are really important during the procedure, just to make sure that his blood pressure stays up, and gives us a portal of entry to give some medication if we need to. So it's almost ready now to be put under anesthesia. Is now giving an anesthetic induction agent. Webster will go to sleep now. He'll be under anesthesia, and then we can get the endotracheal tube down his mouth. Good night, Webster. Technician now is going to... Webster's just in the light plane of anesthesia, so technician now is just going to be putting down a tube down his throat. So that's going down the trachea. That allows us to hook Webster up to a gas isoflurane machine, which is just right here. Technician is just filling up a cuff, just that there's no aspiration. Putting a little bit of lubrication in his eyes, keep him nice and moist during anesthesia. And you can see that he's hooked up now to the anesthetic machine. During the dentistry, it's just really important that we keep him warm, so that's a recirculating hot water blanket that will keep him warm during the procedure. So Webster has now been transferred over to the wet-dry table where the dental procedure will take place, and the girls are just putting on a EKG just so we can keep track of his heart. It's very important to be monitoring closely when they're under anesthesia, so we'll be doing that by monitoring the heart, as well as we use a pulse ox. This machine here, flipped over. That just gives us an indication of the heart as well as the oxygen saturation of the blood. So Webster's now ready for his dental procedure, and the first thing that we do is the doctor comes and just checks and makes sure that all the teeth are okay, because although we assume that everything is fine, sometimes there can be underlying pathology. So we have a dental probe, and the first thing we do is we just probe around the teeth looking for any evidence of pathology. We make a note here that there's a chipped canine, but certainly, and then we move along and we just probe looking for any pockets below the gum line, because although it looks like the problem is on the tooth, the problem is actually what you can't see, it's below the gum line. So we are going to scale and polish the teeth to remove all the tartar here that's building up, but it's just really, really important that we have a look below the gum line too as well. You can do that with x-rays, or you can do it, in this case, we're just using a dental probe and just making sure that all the teeth are fine below the gum line. Okay, thanks. So once the doctor's had a good inspection of the mouth, made some notes pertaining to pathology in the mouth, now it's the technician's turn. She's just packing off the back of the mouth, and then she'll be scaling the teeth to remove all the tartar that's building up, not only on the crown of the tooth, but underneath the gums. She has the hand scaler there, and she's ready to go. Webster has very, very heavy tartar on some of the teeth, so she's just using a hand tool to remove some of the calculus, the really bad tartar that's built up on the teeth. Being gentle not to disrupt the gingiva. This is a hand scaler, very similar to what you would have done when you go get your teeth scaled. So she's removing the heavy tartar on the crown of the tooth, and then being really gentle as she removes the tartar below the gum line. So after the technician uses the ultrasonic scaler, then she goes around with a hand tool scaling below the gum line. Thanks. Technician is now using the polisher on the teeth. Primary function is to, in theory, keep the bacteria from attaching onto the tooth, but it's also aesthetics. Just makes the teeth all shiny, nice and white. So just investigating on this other side now. We had spoken to the owner already about this tooth here. There's some teeth that are overlapping, and it's causing tartar to form below this tooth. So this tooth has a large pocket in it, so we will be pulling this incisor. It's very common when we go in to do just a basic cleaning and scaling and polishing of a dog's teeth that we find other pathology. They can't talk like humans can. They can't let you know they have abscess, sore teeth. So that's why it's really important, yes, to get the teeth scaled and polished, but more importantly to make sure there's no underlying pathology to other problems that need to be addressed while the dog's under anesthesia. So Webster does have a abscess tooth here, so we're going to be pulling it. And yeah, thank you. Tooth out, we first have to make a flap. Flap's really important because once the tooth is pulled, there's a large hole and it will need to be filled. So right now I'm just preparing a flap. Once the flap has been started, then we can use an elevator that we use to take the tooth out. It just helps us get some leverage and to pull this tooth out. Thanks. So we're just pulling out the tooth now. You can see how long the root is. Most dogs have very small crowns relative to their roots. So that tooth is pulled, and now what we see is there's a very large hole. That's why we have a flap to fill across. Just to help with the get rid of some of the infection, we just flush some chlorhexidine down into the hole. Get rid of some of the pus and bacteria that has been forming. Thanks. So now I'm just suturing that flap closed across the holes that were formed by pulling the teeth. Okay. So we can see now that the dental surgery is finished. The rotten teeth are pulled. There's a nice flap going across the void. Now the technician will come back in and finish up scaling and polishing the teeth. So, thanks. We've just finished up here, and just want to show off those nice white teeth now that are tartar-free. There we are. Beautiful. Thanks, Webster. So it's time to say goodbye to Webster. Now you know what goes on back here. Bye, Webster.